Hello and welcome everybody. I'm Anthony Gonzalez. I'm the Senior Program Coordinator for the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. And I want to welcome you all today to our webinar titled Maximizing Impact: How Colleges and Community Organizations Can Partner for Harm Reduction. Our panelists will be featuring Jan Kaufman, William Perry, and Dr. Beth Weinstock. Before we get started with today's content, I do just have a couple of housekeeping slides I'd like to share with everybody. Here on the screen should look somewhat familiar as we are in the Zoom webinar format. We do welcome your questions at any time throughout the live session for our panelists, but we do kindly ask that you utilize the Q&A feature. We do have the chat enabled, so please feel free to introduce yourself as well as any resources and reflections on the presented content. But we do kindly ask again that you utilize the Q&A feature for your questions just so we can keep track of them a little bit easier. We also have live captioning set up for today's session, and you should be able to turn that on to your liking through the bottom dashboard. If you have any issues getting that set up, please send me a message and I will try my best to walk you through that process. We also encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. I would also like to share a few upcoming events. We have our next water cooler chat taking place on September 10th, which will be focusing on the community partnerships in opioid overdose prevention, and will be facilitated by William Perry. So we'll be able to kind of continue today's conversation into that water cooler chat format. Additionally, we have a few offerings for Recovery Month taking place in September. We have a free Recovery is Spoken Here Recovery Ally Train the Trainer opportunity. Seats are limited, so if you are interested, please reach out to me or send me a message and I will send you that registration link. As I shared, we only have about 8 open seats left for that training. Additionally, we have a free webinar taking place at the end of September and will focus on ethics in the collegiate recovery professional. And with that, it is my great pleasure to introduce to you all our panelists: Jan Kaufman, Director of Health Promotion with Washington and Lee University; William Perry, co-founder of This Must Be the Place; and Dr. Beth Weinstock, founder of BirdieLight. And at this time, it's my pleasure turning it over to Ahmed Hosni, who will be moderating our conversation today.
Yeah, thanks, Anthony. I appreciate you. Hi, everybody. My name is Ahmed Hosni. I use he, him pronouns, and I am the Director of Recovery at the Higher Education Center. And I just want to thank you all for being here today, joining us for this very important conversation. Today, we're going to be discussing the rise in overdoses among young adults on college campuses and ways universities can partner with community partners to bring life-saving harm reduction resources and services to their campus. Since 2018, we've seen overdose death rates rise in the 18 to 24-year-old population significantly. We're also seeing accounts of these deaths occurring on college campuses because these are environments which are increasingly susceptible to overdoses due to drug experimentation on campus and the misuse of prescription drugs. And while we're seeing many campuses beginning the work of developing the capacity to provide harm reduction services, we're also hearing from many of our colleagues that there are barriers that are preventing them from doing this work on campus. And so today we're excited to hear from 2 national community partners, This Must Be the Place and BirdieLight, as well as a campus professional from Washington and Lee University, on how they have partnered to increase their capacity and to navigate some of the barriers or bumps in the road to doing harm reduction on college campuses. And so first, I'm going to turn it over to my friend and fellow Buckeye, Perry, to talk about This Must Be the Place.
Hello, everyone. I am Perry. I am the founder and CEO of This Must Be the Place, which is a Columbus, Ohio-based overdose prevention, naloxone distribution nonprofit. And yeah, we focus on doing our overdose prevention through the arts. Is really where we started. I guess to back up just a second, I'm a chemical dependency counselor, trained chemical dependency counselor, have a few other credentials in the recovery field. What we were seeing coming out of COVID lockdowns, and really the terrible spike in fentanyl related overdose deaths, was, I was working in an office setting in that time, and I knew that there were plenty of people that would come into that office. But what we were realizing was that there was this really huge gap in coverage of care for the folks that maybe because of stigma, because of a multitude of barriers, might not come into that office setting. And that's really where the idea for This Must Be the Place formed, because we wanted to be able to go to them, and wherever they congregate, that is the place where we can do our work. And doing it through the arts, whether that be music, art, like painting, writing, reading, any of those ways that folks express themselves, also people gather, and we're able to reach them in a very comfortable and relaxing place, but also have a really candid conversation in those moments about overdose prevention, about different ways that they can protect both themselves and their communities that use drugs. And that led us into doing actually a lot of music festivals, which was kind of a wild jump at the time. We started out in 2022 pitching major music festivals. We were lucky enough that 8 of them that first year allowed us to come in and hand out naloxone and do peer-to-peer style trainings on site. We weren't sure exactly what the reception would be when we entered those spaces. But that's where kind of we co-aligned with the college age community, because it's a lot of young folks. It's really like the 16 to 40-year-old demographic that highly attend these festivals. But we ended up in 105 days that first year, passing out over 10,000 naloxone kits through those 8 festivals. We were really exhausted at the end, but 2 things happened when we were done with Burning Man that year. Was, first of all, our inbox started filling up with reports of people who had used the naloxone that we had given them and had reversed overdoses and saved their classmates, saved their friends, saved their families. And then also that first year, those festivals, those even corporate festivals that allowed us in, gave kind of a permission structure for other entities, other corporate entities, other music festivals to allow us in as well. And actually our inbox started filling up with requests for us to join. I think you could switch the slide here. And our, the next year we did 27 festivals. This year we are doing 34 in 23 different states. Along with 40 smaller localized campus events. And that's a massive growth that I and my wife founding this, really that was a tough thing to manage, but we always have had we've always had the method of say yes and then figure it out, which is kind of where our later conversations will come in on how to help support an organization like that. But we've really been bolstered as we are a national organization. There is no national naloxone distribution entity. It just doesn't exist. It's done state by state through SOAR funding and different state-based funding. So we had to figure out, once people asked us into their areas, how to source the naloxone itself. And we were able to actually manage to get a donation of 30,000 doses of Cloxato from Hikma Pharmaceuticals that was donated free and clear to our organization, that we were allowed to take wherever we wanted to, which that also prompted Walgreens with their new generic that they've come out to to now give us another 25,000 doses, which that's actually just speaking for this year. And so this year alone, we will, including our work in Ohio, we will hand out over 60,000 naloxone kits to people in the college age demographic. And we do that with zero federal funding, which means we have to get really creative with these partnerships and the way that we collaborate and the way that we do logistics. But like I said, we say yes, and then we figure it out later. We operate on a shoestring budget, but we want to be everything. We want to be everywhere. We want to do it all at once. And, we also work really hard through This Must Be the Place to normalize naloxone, because one of the largest bits of feedback that we get from everyone is just their stigma involved in this. They're not sure how their friends are going to think about them when they have naloxone. And one of, I guess, our biggest brags to date is the New Yorker profiled us while we were doing Governor's Ball in Flushing Meadows, New York. And there it is right there. Right. They drew up a sketch. The Festival Narcan booth is something that went out for everyone to know that this is something that's important, and this is something that can be everywhere. But it doesn't always just have to be a massive festival for us. We are just as fine doing an event where 20 students are in a classroom, and we get to have that conversation, which, training on the naloxone or fentanyl test strips, that takes 5 minutes. And then we get to have, that true peer-to-peer conversation with those students where they can ask the questions that maybe they haven't wanted to have in their Google search history, or they've been not so sure about asking an authority figure, or someone they perceive as an authority figure. And through that method, we have just been able to get this stuff out by the pallet load. But we're really grateful that, different entities have paved a way for us, really helped us out with our mission. That unrestricted, border-free naloxone was instrumental to the growth, and through that, we've actually, and our post-training surveys, we've learned a lot about the population that we are serving, what has been effective for them, what was the most important things that they learned. And yeah, we'll get into all that in a bit, but that's just kind of a rundown of what our organization does. If you want to learn more about us, and kind of look back through our story and our travels, just give us a follow on Instagram at Be The Place. But other than that, yeah, that's our nonprofit.
I'll take it from there. Thank you, Perry. I love that phrase, all at once, because again, this opioid overdose crisis needs to happen all at once. A solution needs to happen all at once. And that's how we addressed our nonprofit as well. Just to introduce myself, my name is Beth Weinstock. I'm a practicing physician here also in Columbus, Ohio. I went to Ohio State Medical School and then stayed in the area. And so I practice 1 half day a week, because as Perry would also attest, running a nonprofit is apparently way more than a full-time job. So I've cut back my medical practice. And of course, that's not necessarily why I'm here today. I'm here today, really the core of what we do is because in March of 2021, I lost my son, Eli Weinstock, to an accidental fentanyl ingestion while he was a sophomore at American University. As a college student, Eli was thriving, really doing well in his studies and socially. But one night, he happened to take a pill that I'm sure he thought was something else before he went out with his friends, and he collapsed and died in his campus apartment. So, 6 months after that, which I look back on and think was mighty soon, but 6 months after that, my daughter and I founded BirdieLight, which is essentially our 501c3 nonprofit that sole mission is to educate on the dangers of fentanyl and to distribute life-saving tools. Our overall vision, though, is that we try to imagine a world where no young people are dying from overdose. That's our vision. And you know what we bring to the table, really, we believe we are the only national physician-led, data-driven organization that's focused solely on education for young people, middle school up to age 25, education on what is fentanyl, where is it found, and how do you stay safe from it. And so, next slide, please. The way we structure our organization is we really have 3 arms of what we do. The first thing, and probably the most visual here that you can see, is that we do in-person events. We go to high schools, a lot of universities and colleges, and we gather in spaces that might be as small as this picture on the right of a fraternity at University of Southern California that really no one should have been sitting on that couch, but there I am sitting on that couch. So we speak to young people in small little spaces. We go, the picture on the bottom left is a high school where I educated that day over 3,000 students. The picture on the bottom right is an event we did at American University. This was our kickoff event, which of course is where my son Eli was attending school. And we just spent an entire day on the campus, both doing auditorium events as well as tabling events. The upper left is a sorority group at a different university. And this is just a sampling. What we try to do is we don't exclude anyone. We go to middle schools. We will do events at any organization on a college campus, or if the college campus is small enough, we'll do an event for the entire campus student body. We do events for graduate schools, medical, law schools, social work, nursing, physical therapy, you name it, we've done it. And we also do parent groups. And then, of course, the avenue by which we're here today, we have webinars where we try to reach a bigger audience that we can't travel to. So this is what the in-person events look like. The other arm of what we do is a national fentanyl test strip distribution network through the mail. So we try to get test strips to people who need them that might be living in a rural area that doesn't have a local public health department that's distributing them. And that's been very popular, and in fact, has required a volunteer just recently to nearly double what her hours are every week just to get all that shipped out. And then the third arm of what we do, can we skip forward 2 slides here just so I can show you the third arm? There we go. The third arm of what we do is that we've created a digital curriculum, both individually for middle school students and then one for high school and college students. And then there's a third one for healthcare professionals that's in the works right now. But what this is really is verbatim. It's a curriculum that an educator can deliver independent of our organization traveling to the location. So if you think of all of the high schools across the country in rural areas, et cetera, we created this so that any health teacher or prevention specialist could teach about fentanyl safety with our digital curriculum. This is a picture of the actual box that comes in the mail when you have the curriculum. It's a little more swag based, a little bit about flyers, sample test strips, and then there's some educational posters for a school or even, a student group, a sorority, a religious organization to hang in their hallways, just educational posters. And this is being taught right now at several, I think over 20 rural high schools in Ohio, in scattered places across the country. And then also we are currently training educators at the Mississippi Public Health Department to distribute it across the state there. So 3 arms: in-person events, fentanyl test strip distribution nationally, and then curricula. Let's go back a slide. Yeah, and so this is really consistent across the country, and it doesn't matter, honestly, if we are doing the survey question for high school students, college, and even medical school, even graduate school. Around 96% consistently tell us that they did not know how to stay safe from fentanyl on a very granular level before we educated them. And this is consistently shocking to me. Hopefully it's changing. But even now when we survey college students, nearly all of them say that they did not get much education on fentanyl in high school. And so we are trying to change it on all different age levels. The most shocking was a medical school group that all of them, 100% said that prior to us coming there, they had not had fentanyl education in middle, high school, college, and so far in medical school. So we are trying to change that as quickly as we can. So far, we've educated over 60,000 students, and that doesn't include the broader reach, say on webinars and Zoom audiences that we haven't really been able to gather as much data about. But also in addition to that, healthcare professionals, social workers, hospital systems, we do grand rounds for primary care doctors, and so on and so forth. So what we're trying to do is create a ripple effect so that any person that has a touch point with young people, no matter what direction they're coming from, we want them to know all about fentanyl so they can talk about it. Again, like Perry said, we are trying to destigmatize. We want the fentanyl conversation to become as common as tobacco safety education, alcohol education, even as far as seatbelt use, sunscreen use, that knowing about fentanyl is just something that everybody knows. And in that way, it becomes less scary, becomes less stigmatized. And of course, we do have reports back of lives saved. And of course, we'll never know of the people who maybe would have used a substance that had decided not to because of our education. But we know those numbers are out there. They're just hard to gather. And then lastly, how we've collaborated with colleges. I'll probably get to this more in our later discussion. But again, our main driver is often to get the students involved. So we will be invited by multiple Greek life organizations, whether it's interfraternity councils, national councils on every campus for different types of fraternities, sororities. But also sometimes we'll just get one student involved that is in the School of Social Work. And we will work with them to arrange an event for their entire class. Or it might be a graduate program that invites us. We also get invited by student health centers and the professionals that run them to come to the campus and do campus-wide events. That gets a little more challenging with a school like Ohio State or a bigger university, but we collaborate in all different ways, particularly to do pop-up events on like the Oval or the Diag, and then combine that with an in-person education event. We've spoken to groups as small as 4 or 5, all the way up to over 4,000. So every interaction we have to collaborate looks different, and we stay flexible. We know that anyone we talk to about fentanyl that then has the potential to pass it on might be saving a life by doing that. And so we work with campuses to collaborate in any way possible. We have come to, I'll just give you some examples, Cardozo Law School in New York City. We went to Hillel, the Jewish student organization, on several campuses. We did an event for, we're doing an event at USC for the Graduate School of Social Work, people who have a focus on addiction and substance use disorders. We have done events to student interest groups, pre-med, pre-law, social work, nursing, et cetera. And then again, sometimes if the campus is small enough, we will try to do an all campus event to include everybody. Yeah, and so I can speak more about that in a minute, but we really try to get students involved because, as all of the audience probably knows, as soon as you have student buy-in, your turnout's better, the enthusiasm's better, and you end up reaching more people. So I'll pause there and pass it on to Jan. Thank you.
Thank you, Dr. Weinstock and Perry, for sharing the important work that each of your respective nonprofits are doing, both in terms of education and harm reduction. So I want to spend just a few minutes talking about Washington and Lee. And our thinking and work around harm reduction and the partnerships that we have formed, including bringing Dr. Weinstock to our campus. So we are a very small private liberal arts school in Southwest Virginia. We're actually the 9th oldest college in the US, bit of trivia. But we are rural. We're about an hour and 15 minutes away from Charlottesville and UVA. We're about an hour north of Roanoke. We do attract an elite group of highly motivated students. We have about 1,800 undergrads and about 400 law students. So we're able to call ourselves a university because of the law school. So we have an undergraduate college, which is our liberal arts component. We have a very robust business school, which is unique for a liberal arts school. It is comprised of accounting, marketing, management, and economics. And then, of course, our law school. We're Division III in terms of athletics. And one of our cornerstones is our honor system and student-run government. And our core values that are spouted over and over again in all realms of the university are honor, integrity, and civility. And we are a very highly Greek campus with about 75% of our students being Greek. Next slide. So our mission statement, I'm not going to read it to everyone, but once again, the programs and majors and minors on our campus really strive towards the things that are on the bottom: leadership, service to others, and being global citizens. And our motto is not unmindful of the future. So as an institution, we are always encouraged to think to what's next and how we're going to excel in the what's next. So just in terms of our structure for health promotion and wellness, we are housed overall generally in student affairs, and this office is part of our greater health and counseling team. I will say upfront that because we are a small school, I am an office of one. So I am a generalist, and on the next slide, we'll talk about the topics that I cover. But in terms of AOD prevention, I feel like we have 3 prongs. One is prevention and education, and pretty much that comes out of the Health Promotion and Wellness Office. Our second prong is counseling and recovery, and our counseling center pretty much manages that, including our recovery support group and our recovery house. So we actually do have a house on campus that students who are in recovery live in, and they have a couple support meetings during the week, and they also organize substance-free events for campus. So really, really important. And they're called the Washingtonian Society and Washingtonian House. And if you say that name on campus, everyone knows what that is. And the third prong is conduct. And that is managed by Residential Life, our Student Judicial Council, and Health Promotion. So Res Life will do an initial line of adjudication, especially if it's a first incident. If it's beyond a first incident to a second or third, the Student Judicial Council kicks in and hears that case, so to speak. What my office does is an educational assessment based in motivational interview. So we kind of all work together to make sure that students get the services that they need and the education that they need in order to make some good lifestyle decisions for themselves. Next slide. So The major areas that health promotion and wellness focuses on here are AOD issues, which would include drugs, harm reduction when it comes to opioids, et cetera, which I'll talk about in a minute. We believe in bystander intervention and education, not just for sexual misconduct, but across the board for all of potential topics. Virginia has mandatory hazing education for all students on campus. So my office has partnered with a broader group to provide that education to the greater community. So 3 years ago, I didn't talk about hazing. Now I talk about it a lot. Risk management of all types and mental health and self-care in partnership with our student activities office and our counseling center. So let me talk just for a minute about our opioid education program and what we're doing in terms of harm reduction. So I would say in 2020, some of my colleagues at our local community services board were talking about becoming trained in the Virginia Revive program to educate people about opioid overdose and use of naloxone. And at the time I said, oh, thank goodness we will never have to do that at Washington and Lake. And fast forward 2 years, I was hearing more and more about opioids across the country in colleges, and I decided to become a trained instructor in the Virginia program. So I did that, and then I started talking to students. Should we be offering these classes? And I got a resounding yes from every single one of them. And then around the same time, a student came to me and said, I just got funding from Contact, which is our student organization that brings in speakers, comedians, musical, bands. Perry, you would love them. And she said, I got funding to bring a speaker in on opioids, fentanyl, and naloxone. She said, but I don't know what to do. I don't know how to make this happen. And I was like, okay, I just got trained in this Revive program, and it's on my radar screen. I will help you to bring this speaker. The speaker was Dr. Weinstock and BirdieLight, and we were thrilled to have her. I didn't know what the student reception would be at the time, but the student has a personal relationship with Dr. Weinstock and her family. So that was her motivation for saying, yeah, this is something that I want to bring to my campus. And because of the death of a personal friend, it's now personal to me. And I think that connection is so, so important. When someone has that level of investment, then they're going to put their heart and soul into it, and that will become contagious to their friends. And I believe that's what ensured us having a great turnout at the program. Would you go to the next slide? So students developed this poster. We also posted it on social media. We asked people to register, not that they needed to, but we wanted to just kind of keep it fresh, keep people engaged. We wanted to get a little bit of sense of, would people actually come? It was the first time we ever had this level of conversation in our very small private university. And you can see from the bottom that sponsorship we had multiple sponsors. We had our student organization that brings speakers. we had the sorority that she belonged to, a Washingtonian Society, which is, you know, our group on campus for students who are in recovery and or want to change their relationship with alcohol or drugs. We do not require sobriety. And then our health promotion office. So we had about 75 people come, and there was a lot of chatter afterwards, and students were talking about it to their friends the next day. So we said this was a very successful event, and since then, next slide, our students have continued that conversation. We borrowed from BirdieLight the idea of having test strips. They were using Dance Safe at the time, and we contacted them and said, you know, we'd like to offer these on our campus. They do have an institutional nonprofit price, which we were able to tap into. And we developed a two-sided card with one side is directions for how to use the test strip, and the other side was a little bit of info on fentanyl overdose and how to respond, which was based off of the Virginia Revive program, and then how to sign up for a Revive program with a QR code. Next slide. So where are we going from here? What's the future? We will, of course, continue the Revive programs. And I would like to have Narcan boxes, kind of like AED boxes, at what I call the point of party. So actually where the students are partying, in their Greek houses, and we have a big party culture at off-campus houses. We only require students living on campus for 3 years. So our seniors are living off campus, and there's an allure to holding parties at these off-campus houses. So the logistics around that, I started that conversation last year. Our vice president for student affairs was retiring, and I think didn't want to touch that with a 10-foot pole. And frankly, just kind of said, not yet, we're going to let the next person kind of weigh in. But in the meantime, I did some research, and there's many companies. A lot of people have heard of One Box. I found this other company that was a little more user-friendly in terms of price point. But the other thing that I liked about it was you can see on the side is a container for the test strips, which I thought was important. We will, through our student health committee, continue that conversation with our new vice president of student affairs. I believe he is already on board based on the couple individual conversations we have had. I also, Virginia Department of Public Health may be offering some of these boxes to universities. I actually have a phone call scheduled with them after we got off of this webinar. So I hope to be able to offer some good news on that front to my university. And as of earlier this week, our legal general counsel's office has approved the protocol for our public safety officers to be trained and carry naloxone with them on all of their shifts. So I'm excited about that. So we will start training them in the first responder program starting, I think, next week.
All right. Thank you guys so much for sharing more about the work that you all are doing within your respective organizations and on campus. And so we are excited to jump into some questions. And First, I just wanted to share that for me, when I was thinking about this webinar specifically and wanting to have this conversation, it stemmed from the fact that here, in my day-to-day work at Ohio State's campus and helping to lead a lot of our alcohol and other drug initiatives, we have access to the resources to do harm reduction work and the capacity to do that. And oftentimes we are having conversations with other universities who are hoping to do that work themselves. But one of the things that I find is that that there are often barriers that universities experience, and sometimes those barriers are capacity. Jan talked a little bit about the being at a small university and wearing multiple hats and the difficulty it can be to set up a distribution program when that is the case and you're a generalist who's asked to do all of the education in your health promotion office. But then the other aspect is also a question that we got in the chat. And so the question was around a university that will not allow even outside entities to come to campus and to do harm reduction work due to stigma. And so what I wanted to ask y'all is, what experiences have you had in working with universities who seem to be reticent to the idea of your organization coming to campus and doing the work, or to the idea of harm reduction? And maybe what is some of the feedback or some of the experiences that you've had in trying to work with them?
I can go first on that, Perry, if that's all right. I'll be brief because I know of time. You know, in the beginning, we started doing this in 2021, and in the beginning, we found a lot of resistance to us arriving on campus when we would approach it, sort of the phrase like from the top down. We found that it was hard to speak to a school administrator and convince them that what we were providing, what we were offering was necessary. I think, you know, and I don't know this across the board, but I think it's hard for a university to admit that there might be drug use on their campus, that the risk exists, that, you know, even if they might have had a community loss, a fatality, maybe that happened off campus, you know, and you know, and I understand. I mean, it's a very complex issue. So we found right away that, you know, sort of do first, apologize later, is that if we got invited by a student group, no matter where and how big they were, we would just do it because maybe their advisor for the student group was saying it was okay. And I only say that not to be sneaky, but you know, schools are massive places, right? And if I have a meeting with the provost, chancellor, president, you know, and I don't even know, there's multiple layers of that kind of progress would take so long. And I, again, felt the urgency with this kind of crisis. So we approached it early on. It's getting easier now, but with a bottom to the top progression. And that really worked for us.
Yeah, and I can second that. You know, we've had really successful partnerships with universities, and we've had student organizations that have reached out to us. Their advisors have even like done some of the groundwork to make sure we had a space and everything. And at the last minute, the university said, "Oh no, not here. We don't want the parents to get the wrong idea." And I think that goes back to where we've always really been imagine like we've used our imagination when it comes to the wares that we do this and how we do it. And so in one specific example, you know, although they said we could not do this on campus, hey, there's a coffee shop where students congregate that's directly across the street from the campus, you know, and so we reach out to them. They say, sure, you can come in and we can fit about 40 people in here. And we were able to come out and still have that we're following state guidelines. We're following all legal guidelines. We're educating the students, and maybe we left the students with a few extra kits that that they can then disseminate, which is another core part of what our organization believes in. As we enter a university, yeah, we can't always be, and this is even in the larger, and especially in the larger universities, we come in, we leave, but we want to train the trainers as well, and like we are able to then leave them with some supplies that they can then disseminate amongst their peers, because especially like as both Beth and Jan mentioned earlier, that student buy-in, that hearing it from your peer becomes so vital. And when you arm them with the resources in which to do so, these things end up in exactly the right places, because the students know far better than us where those places are. And like, as much as we can have a candid conversation, and as much as we can like really relate during our session, whether that be a hour and a half long session with the students, they might not give us all of the information to know these places, but they already have it in their mind where this stuff is needed. And then, and that's where it's just our responsibility to trust in the process and know that these students who have bought into this are then going to take that and move forward with it. And, but yeah, like, it comes back to policy all the time with these colleges and universities. And, I think that's what's so important about having a conversation like this about partnering with community organizations, because I know like both Dr. Weinstock and I are state of Ohio registered Department of Health entities. So moving about the universities in Ohio makes it really easy, because we have that kind of stamp of approval. And actually our organization now has that in, I think, 8 different states, which Revive in Virginia is one of them. But it allows us to do this in a legal way that is outside the need to have the university's legal department run through it, because hey, they're lawyers, they get paid by the hour, so they might stretch something out. They might want to stretch it out for 3 months, so those billable hours. I don't know. But yeah, this is a way to, because this is not a problem that we have time to wait for.
Yeah.
The time is now.
Yes.
And we need to, and if we can't get this done in our institution right now, let's figure out who the people are that can get this done, and just use our imaginations and figure out exactly how to do that.
Yeah. Thank you, Perry. Jan, did you have anything to add?
I just want to add that I think this topic is very much on the minds of our young adults. I was with our RAs this morning doing training on high-risk behaviors, and I started off with the word cloud. What high-risk behaviors are on your mind? And the number 1 was drugs, number 2 was alcohol, and number 3 was gambling, actually. But then when we talked about drugs, they were like, yes, we need that Revive program on campus. Are we going to continue it this year? And I was like, absolutely. I'll do as many programs as I have people who want to come.
Yeah, that's great. And Jan, I wanted to follow up with another question that I had, and I really appreciated what you shared about again, the for me, the stark difference between working on a smaller campus. I'm at Ohio State, so much larger campus, and then a smaller campus, and maybe some of the more inherent struggles that being on a smaller campus in an office of one, and the things that you've described, and with doing like certain things, or maybe moving pretty quickly with projects and things like that. What advice would you have to folks who are at similarly sized campuses, or maybe are on campuses where things like time, capacity, and resources may be something that they struggle with?
Oh boy, yeah, that is a big one. I have worked on college campuses essentially my entire career, and I've been at Washington and Lee since 2001 full time. So I have essentially built this program, and when I was hired, it was as a result of two students dying in a car crash. So my initial charge was alcohol education and more alcohol education and more alcohol education. And as different topics have surfaced to higher prominence, then I have just pivoted and learned that information. So part of it is I am just a huge consumer of information, which takes time. I have also had some very successful partnerships with some of my colleagues in student affairs and across campus. And actually, even my colleagues at other universities in Virginia, everyone has been very gracious in sharing thoughts, ideas, materials. So I haven't always had to start from scratch. And I guess personally, I enjoy the challenge of learning new things and engaging in new kinds of ways with, especially with the students. So I guess it is because I'm willing to go that extra mile.
Okay, thank you. Perry, Dr. Beth, any advice that you would have for as community organizations for small for any campus really, but especially campuses that maybe are just struggling with having the time to be able to do this work on how best to partner with not only your organizations but also local organizations, and maybe here in Ohio we call them Adam H boards and things like that, but maybe like a local community mental health board or a statewide group or something of that nature.
Yeah, I think oh, sorry, Beth, you're on mute. Go ahead.
Sorry about that. You saw my mouth moving, but nothing was happening. Yeah, I was just going to say that it becomes a bit triangular. So for example, our mental health board here in Franklin County, we've partnered with and they've provided us with many grants to create events, whether it be at a high school back to school festival so that you can talk to parents also, or also events at Ohio State. So that's a great partnership because sometimes they're the ones providing the funding. The second part is that for especially someone who's in Jan's role or a professional role that feels overwhelming or overtaxed, or where do I even start? Always, 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 students can do so much of the work for you. So for example, at one school, the student health professional said, I want you to come to our campus. Let me reach out to, for example, the student president of, and you can insert there, the Intrafraternity Council, the student president of, a group on campus that tries to avoid substance use and do harm reduction. And then once we're connected with that student group, they'll partner with us. And then we also then are contacting the student group to help find a space, to create the invite, to disseminate the invite. And then sometimes the student health department stamp is on it, but you have student engagement. And I'll tell you, like Jan said, they want to do this. A whole generation has been scarred and traumatized by the opioid epidemic. And when I'm in a room with students, there is rarely a time when, I ask, has anyone in the room been touched by the opioid epidemic, or more specifically fentanyl? And just hands shoot up. Kids sometimes will leave the room when I'm speaking, because it affects them. It's traumatizing. Maybe they leave in tears and go to their guidance counselor, because it's not just me. It's like I said, over 112,000 people in 1 year. This is touching everybody. So if you can find that student group that says, I've got an army of 5 here, I'm going to do all this work for you. Let's get people to the auditorium. That's the best advice I could have, because turnout's better. And then maybe some of that legwork can be relieved from your overburdened or overtaxed office.
Yeah. And yeah, to follow up with Beth, we've got research that we'll be actually publishing next week, that within this age demographic, over 60% of these kids have known someone in their close social circle who has overdosed, whether fatally or non-fatally. So this is something that they are already bought in on. The training is going to add to that, but they already mostly, for the most part, a majority of them have the motivation to have this. And so, yeah, engaging those student groups is vitally important. But also, I think being malleable to exactly what this looks like is a really good way to help. It doesn't need to be this rigid program and okay, we see what your program looks like and we need to figure out a way to fit exactly that into some space. It's identifying these needs, identifying what the students want, identifying what works with that nonprofit organization or that community health organization within a time frame, and then, like Beth said, finding space for it, finding time for it. That is, I mean, one of the hallmarks of achieving naloxone and education saturation is that it is convenient and low barrier. And so how do we make this convenient and low barrier? And that also includes both the institution and the organizations. Let's make it convenient for them as well, because we're just small organizations operating off of really, really tiny budgets. But the second that someone gives an organization like This Must Be the Place or BirdieLight the opportunity, and from working side by side, shoulder to shoulder with Beth, I know that we're going to find a way to get there, and we're going to find a way to make it work, and we're going to find a way to reach those students. Just ring our phone, and we're willing to do it, but we're also really, 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 it's integral that we work with the students. That's listening to your client base and hearing the concerns of your client base, and not deciding what they need, but listening to their concerns and then meeting them in that spot.
Yeah, thanks, Perry. And so when I think about working with local health departments and the experiences that I've had here at Ohio State, I think that sometimes I am reticent to talk about Ohio State and the work that we're doing here, just because it's difficult to compare to a university this size and things like that for a lot of folks. But I think what's important is that I've been here now for 10 years, and the conversation around naloxone and harm reduction started 10 years ago. But we didn't to the place we're at today overnight. And so I think for anybody who's in the audience and who is thinking that it feels like the barriers or some of the stigma that you experience, it feels like the walls that you're running into are insurmountable, I promise you that it's the slow, steady, sometimes inch by inch progress that will get you to the place that you hope you're at one day. And maybe it'll even be the person after you who comes after you who gets the baton across the finish line. So for instance, early on, before there was an appetite for us to be disseminating naloxone ourselves, and before we had the resources to be able to do it, because we receive our naloxone from a statewide program in Ohio, one of the things that we did was partner with the College of Public Health. And the College of Public Health didn't need to go to the leadership of my department to ask if it was okay. It was a part of their mission as public health experts to be doing this work, and partner with the College of Social Work. And it was through those partnerships that we were able to find naloxone, plan events, and then to disseminate it to students, staff, and faculty. And so early on, our efforts were very grassroots. And so I would think about any organization you're doing in this work as grassroots. And of course, like trying to navigate the fine line of getting yourself into trouble, right? I'm not advocating that anyone does anything that would cost them their job. But one of the ways we were able to start changing the hearts and minds of folks in leadership for me was just sharing the news, right? And like for instance, the NPR just recently had a podcast and a written paper on overdoses on campus, right? And so it was just earlier this month. And so um had this come out 8 years ago and there were things like this coming out, I would share that with folks that I needed to read it. And I needed them to understand that this is not an issue that our campus is immune to, and this is not an issue that cannot reach our ivory tower. This is something that is happening to people from all walks of life, and so that's just one thing I wanted to share. Not to go on a soapbox, but just please stick with your efforts. Don't never stop trying. Know that we appreciate any effort that anyone on any campus is doing to save any student's life, like Perry was saying earlier. Yeah, I just want to thank Perry, Dr. Beth, and Jan for their time today, and really encourage you to reach out to Perry and Dr. Beth to learn about how you could partner with them. They do national work, but also to encourage you to get out locally and to meet folks from the local service board and the statewide health department, local health departments, anybody you can, to learn about what's happening in your community and to think about how you can use grassroots efforts to even making the naloxone available to 10 students is better than making it available to 0 students. So Anthony, I will turn it over to you.
Well, I echo everything you just shared, Ahmed. A big thank you to Dr. Weinstock, to Jan, to Perry, and to you, Ahmed, for leading this conversation. Thank you, everybody, for sharing of your expertise and of yourself. I'm just going to share some quick housekeeping slides. Just a reminder that today's session has been recorded, so you can expect to see the recording uploaded to our website within 3 business days. Of course, if you have any questions, feel free to connect with us. I did see that Dr. Weinstock dropped their contact information in the chat, so thank you for sharing that. But of course, feel free to reach out to us and we can get you connected. Again, a quick reminder of some upcoming events. We can continue this conversation next month on September 10th with Perry, and the conversation will be focused on community partnerships in the opioid overdose prevention space. Additionally, we have 2 upcoming recovery-focused events. We have a risk training taking place on September 17th. Registration is limited, so if you are interested, please email us or send me a message and I will send you the registration link. And additionally, we have a ethics webinar for the collegiate recovery professional taking place at the end of September on the 26th. Thank you again for everybody joining us, and I hope you have a great rest of your day. Take care all.